I know. So many people have been having problems with Zoom, including myself. But I don't know if I told you guys, Jessica's flashing at me. Um, I was having my share screen issues and I called Zoom and it was there was an update, like an upgrade, like you get in your phones upgrade. There was an
Oh,
upgrade that I hadn't seen, nor would I even know to go into my settings on Zoom to see if there was an upgrade. And so she was super nice. The customer service lady was super nice. She walked me through and go to my settings, and sure enough, there was an upgrade. And
oh, okay.
as soon as I did the upgrade, everything was perfect. So you might want to check that because I think we all use the same Zoom.
Yeah.
So you might want to
Or
just double check that and see if, and it was super easy to get through to Zoom customer service. They picked right up. So, you might
I
want to
wonder,
just check that going forward.
yeah, I'm wondering where the
Will
settings are
do.
to see if I could just do it now.
Yeah, go into,
Mm,
I'd have to go back to the home, go to your home Zoom page, like where it has your profile.
okay. Oop, I stopped. Well, actually, I'll wait until after class
Okay,
because in case it starts doing stuff and then I can't get back on and I don't
okay,
want to miss class. I'll
okay.
do it after.
Dwayne, where'd you go this morning?
Something came up.
Oh,
Yeah,
well, watch the recording, okay?
yeah, definitely will.
Dwayne was one of very few people. Where is everybody? Oh, let's see, who else came? We only had We've had all three of our reviews for the exam next week, and between the three of us,
I
Professor
know I
Ford had,
missed all of them.
I
I
know,
missed
Professor,
every single one of them.
it was kind of sad because I think we have 96 or 98 PN community students, and we only had a total of seven. And of those seven, two were repeats, like had gone to a second one. So technically, we only had five.
I
So
thought there was
five.
one of tonight a Zoom review for our exam.
Mm-mm,
That's what I thought.
I sent out an updated schedule.
Uh-oh.
Yeah.
Wow.
I
Okay.
sent out an updated schedule a couple of days ago.
Okay, then I missed that because I
Karen,
actually thought there was one tonight.
nope, Karen's shaking her head. Karen's one of my twofers, right? Yeah. So no, they were Monday, Tuesday, and Wednesday. I sent out that adjusted schedule. Anyway, I think I've already sent out the recording. So I, I don't ask Karen, how did I do this morning in my review?
It was good because you gave us the really PowerPoint we should read, and you told us to read more also. It was
Well,
good.
what I told you was to start with the PowerPoint. I
Yes.
went through the PowerPoint section by section. So I don't, if you only have time to watch one review, please watch my review from this morning. I cannot stress that enough. Okay. I've already sent it out to you. Please go through it. And again, don't overdo it, right? Start with the study guide. The study guide is a summary, right? Summary of all the topics in the readings broken out into sections. And then I've said this before for the last two exams, if you don't understand the sections, whether it's infectious disease, what do we have here? STDs, infectious disease, um, home health, case management, human violence and abuse, disaster management, cultural considerations. If there's something on the study guide you're not understanding, then go back to your readings and read that section again. All right. But do not be reading whole chapters, start to end. That's not most of what you're assigned to read for this exam are bits and pieces of chapters, right? A few pages here, a few pages there. So please stick to that. Okay, try, do not overdo it. But I think I feel confident in the review that I gave this morning, that I reviewed these concepts and topics pretty detailed, right? Karen, would you agree? Yeah. So, yeah, no, there's no more reviews. But that's, you're going to have 3 recordings. I've already sent out Dr. Kershaw. I sent out Dr. Kershaw's yesterday, I think, maybe this morning. And then I sent out mine just a little while ago, right after I finished. All right. So please promise me you'll review my recording from this morning.
Okay.
Absolutely will.
All right. I'm serious.
I
All of
will.
you guys, right. You gotta, yeah, review it. I sent out a schedule for HESI testing. Everybody got that, right? Of when your HESIs are scheduled.
Can I
there's
just
o-
tell you that that prep, it was hard.
the what?
The so I think, I don't know if it came from the dean, but you know how they do the preparedness for your system, the ability to take the HESI without any problems on your system.
Oh
And
yeah,
it was
yeah.
a 22 question like
Yeah.
prep quiz.
Mm-hmm.
I was like, is this what the NCLEX is gonna be like? Like it was a little
Yes, it
hard.
is. Yeah, it is. Did you get through it, Danny?
I did.
Okay.
The only parts that kind of stumped me a little bit
Mhm.
is you had to do, I guess, a concept map. And so
Mhm.
you had to drag and drop based on the case study that they gave you. They wanted you to pick out 3 different issues,
Mhm.
what the intervention was,
Mhm.
and what was the diagnosis based on the issues that you chose. I was
That's
like, oh my
NCLEX.
gosh, I don't know if I'm ready for this, but
Yes, that's
it was pretty
NCLEX.
cool. Like I thought it
Clinic.
was going to be the run of the mill,
Yeah.
select all that applies or drag and drop,
Yeah.
but it wasn't like that
No,
at
it's
all.
case
It was
studies.
way different.
Yes, that's all next gen. And you guys should have your your NCLEX book, right? Your practice book.
We do.
Yeah. And if you and also you should be looking at your what is it called? I have it on my
First,
yeah, but no, I have it the test plan, right? From NC National Council, right? There's a PN test plan. Right? Do you all know what I'm talking about? Look through
Yes.
look through your test plan. I actually have looked through that several times during this term to try and incorporate certain things into class from your test plan. So you should be reviewing your test plan. And yes, what Danny's talking about is next gen questions on NCLEX. Remember, we've been talking about all term. This is taking your knowledge and applying critical judgment. Right? It's great if you memorize everything from nursing school and classes, but if you can't apply it once you get into the setting, that's going to be problematic. Right? And that's why our exams, you've probably noticed this term and the upcoming one, they're scenarios. Scenarios in the clinical setting. What would you do? If the patient says this, is this correct? Or if the patient says this, is that inaccurate and they need more teaching? Please be careful on the next exam about negatively worded questions. Okay? You have to be able to read a question if it says, teaching a family that's going home, teaching a client that's going home after having a stroke. The client said, what does the client say that is inaccurate that you need to do more teaching? What kind of answer are you looking for? Something he says that's inaccurate. A lot of you guys missed that question on exam 2 at the very beginning about American Nurses Association.
Yeah,
I
they're looking
spelled-
for the wrong answer.
I spelled out in the study guide, what are the 3 things that the American Nurses Association are built on? But the question was asked, what of the following is in an inaccurate description of the American Nurses Association? Inaccurate. So all the 3 correct answers were there, and they shouldn't have been picked because they weren't accurate. There was one inaccurate answer, remember? They're specific guidelines. No, they're not. They're general guidelines. So that's a good example. A lot of students missed that question. And when I did my reviews, most students said, I didn't see the word inaccurate. I read it as accurate. Okay, so you guys have to be able to know how to tackle a negatively worded question. You're looking for something that the nurse does or the patient says or something that's inaccurate. Right? And if you looked at that American Nurses Association question and you read through the 4 answers, if you had studied the study guide or read what was on the study guide, you would have saw that 3 of those answers were correct. So that would have confused you. It should have confused you and said, wait, this one's right, this one's right, this one's right. Let me go back and read the question and see if I missed something in the question. Well, what you missed was the word inaccurate. And then you could have gone back and said, oh, okay, well, 3 of these are correct and one's inaccurate. I know I make it sound easy, and it's after the fact, I get it, but don't be afraid to, I don't know why I'm doing exam review, but don't be afraid to select all that apply. Don't be afraid to select all. Oh, somebody told me once that, select all that apply. It can't be all of them. There's just no way. Sure can.
Says
else
on the
did I-
question, it says on the question, right on the question, it could be one, some, or all, or none.
I know, but you would be amazed at how many students I meet with that say, oh, I was afraid to select all of them. I've been told somewhere else along the line, don't select all. So those are just some of the things, be able to recognize how do we get off on this topic of talking about negative questions?
From testing.
Hmm?
Because we started from testing in the exam reviews. and then the
Oh,
test
no, well,
preps, and then
Danny
how
was
to
talking
answer.
about the next gen format.
Right.
Okay. All right. So back to HESI. Everybody got the schedule. So my responsibility is simply to provide you with days and times. It's just kind of hey, by the way, your HESI schedule has been released by your campus for all your campuses. It is now up to you to go to your campus and go online, however they do it, and schedule your HESI. I need to hear from you if you are having trouble. Okay, if you're scheduled, don't worry about it. I'll see it in the system. But if you're having trouble, you can reach out to me or reach out to your campus. Okay, because those have to be scheduled.
I just wanted to say, Professor Marvel, just to reiterate, the 22 question test I was talking about, or like quiz thing, it came with the email from the dean regarding scheduling your HESI,
Awesome.
right? So like when you go
Awesome.
in to schedule your HESI for community, there's a compatibility test that you have to take.
Yeah.
And in that test, it's the 22 questions that look
Yeah.
like next gen
Wow, that's great.
NCLEX questions.
And that was
Yeah.
sent in an email
Yeah, it
Danny?
was.
from Dr. Brown?
Yes. So when
Okay.
you go into the HESI area, right, where it'll say register for your exam,
Right.
on the left-hand side, it'll say compatibility check.
Uh-huh.
And then it'll tell you, like, it'll
Oh.
take you through like maybe 3 steps, and then it'll say either take the quiz or what's next. And then when you go through what's next, it gives you like an hour and 25 minutes to answer 22 questions.
Okay,
That was
then at
that
the end of it-
announcement, right? That was in the announcement I
Right.
sent the other day with the little box that was from Dean Brown.
okay, it's an announcement. I was just gonna go check
Yep.
emails. All right, thank
So-
you very much.
You guys,
Mhm.
yeah, don't be checking your announcements. A lot of information coming. All right. So thanks, Danny. So what Danny's talking about is that announcement I sent to everybody 2 days ago, or maybe even yesterday, that Dean Brown wanted sent out to all the students. Okay. So please make sure you check that. Okay. What else? Today we're gonna review, we're just gonna review content from week 9. We're gonna do we'll review content from week 9, and then we're going to do our group presentations. I did this with my Monday group and they were awesome. So, what questions do you have? We talked about HESI. So you guys, I've already received a lot of them. HESI prep assignment is due this week. Vulnerable populations is due next week, along with your exam. And then we jump right into HESI. So I kind of warned you at the beginning of the term, this is where it starts getting hectic. So if you get your HESI prep assignment done and turned in, and that's your study guide. Okay, we will have next week, I know it's exam week, but all three, Ford, Kershaw, and myself will each schedule a HESI review. That's kind of like this week with the exam 3 reviews. We'll schedule a HESI review. And so you have 3 opportunities next week to go to a HESI review. And I use your HESI review as a study guide, so I'll be reviewing that. Okay, but that's what you need to study for your HESI, is your review. And the ones I've seen so far are awesome. All right, you've already done all the legwork, now we're going to use that to study. Okay, and know that your HESI review, the topics on there are the topics that were asked about on the last 3 terms HESI, PN HESI, Community HESI. Those are the actual topics. Okay, there's 50 questions plus 5 sample questions. We can see what the questions are, we can't see what the questions are asking, but we can see what the topic is. And so each of your boxes on your HESI study review represent a question that was asked. So when you had lipid screening, I don't know what the question was, but they were asking about lipid screening. So what might the question be? And that's what we'll do in the review. We'll go through each of those boxes and think, what do you think they're going to ask based on community nursing? Why is it important to do lipid screening in the community? We'll talk about that in the reviews. Okay? Does that help? But I don't know the questions. The questions are, HESI is done like NCLEX. It comes from a big bank of 1,000 questions. We certainly do the exams, the faculty does, the 3 exams, but as far as HESI, that's not us. But we can see what was asked. Not asked, you know what I'm saying? What topics were covered. So that's what you need to think about as you tackle your HESI study guide. This topic was covered on the HESI. What do they want to know as far as community nursing? Okay. All right. Where do I want to go first? I want to go to the book. Okay, I'm just going to briefly go through a few things that were covered this week that should have been covered this week in the book. And remember, these are pages. These are pages of the chapters. So in chapter 45, care of the patients with emerging conditions, trauma, and shock, you were asked to cover pages 1048 to 1054. So let's go through and see what's in here. So it's at the beginning of the chapter, right? We're at 1047. So, a few things Here's what we need to know in this chapter. Prevention of accidents. There's 3 areas that I want you to read about. Home safety, water safety, and what was the third one? Highway safety. Okay. So as you're working with families, these are safety tips. The home safety, box 45.1, is pretty detailed. It goes through different areas of the house. Okay. And you will get asked about these 3 these 3 areas of prevention. So please review home safety. The few things I pick out of here are slippery floors. Okay, furniture in the way, non-skid or mats that skid around the house. Is it okay to have candles in the house? Sure. But yet they have to be safely used. Make sure candles are away from flammable materials. Never leave a candle lit unattended. But is it okay to have candles? Sure. Carbon monoxide alarms. Okay, highway safety, seat belts. Maybe enforcing better laws against impaired driving. Discouraging use of cell phones. These are basic teaching tools that we can use with families. What about water safety? What happens if there's an emergency in the water? What do you try and first do? Right? You assess, like you always do, for possible neck or spinal cord injury. Right? Trying to
Head above
mobile.
the water.
What?
Keep the head above the water also.
If you can. Right. But if you can't, and you suspect a spinal or neck injury and you can't keep the head above water, you are going to have to take them out of the water. Okay, if CPR can't be performed in the water, you have to remove the individual from the water and start rescue breathing. Okay. And then, so those were the 3 areas that I want you to review about safety. Okay. The other part that I wanted you to review is emergency care. Okay. We may be asked to give emergency care in numerous kinds of settings. Right? The grocery store, the rec center, where you work, the clinic, hospital setting. Okay. So one of the things we need to do is triage. What's triage?
Priority. Who
Setting
goes first?
priorities. Yep. Setting priorities. Right. We use the ABC, airway, breathing, circulation. But here they add a few more. They add D is the assessment of neurologic disability, and E is exposure. All areas of the body should be exposed so that you can see if there's any hidden injuries underneath the clothes. And so, who is our most important when we triage? What are the steps of triage? Who's our most priority patient? Is it the patient that is either
The one that's going to survive.
the one that's going to survive? Does everybody know that? We can't do anything about patients who are already deceased or patients that you assess are going to be deceased or going to. Right? So the ones that are going to survive. What's the least category of patients we worry about in an emergency? What do we call them?
Walkie-talkies.
The walking, oh yeah. Okay, good. I like those. I like that. I call them the walking wounded. Right? And this section goes through the A, B, C, D, E. So I want you to read through that. Okay. It's a review of what we know. Okay. This focused assessment is a good summary of A, B, C, D, E. So Have a look at that. Okay, what do we do to assess airway, breathing, circulation, neurostatus, exposure? Okay. Anybody ever take the class with CPR of Stop the Bleed? Has that been incorporated into your CPR classes that you've been taking?
CPR, yes, and
Direct-
stop the bleed and
Direct
at work.
pressure.
Direct
For-
pressure.
Yeah.
But now the CPR, I think it's Red Cross, they've incorporated the Stop the Bleed class like they did, they added first aid. Well, now Stop the Bleed course has been, it's part of the CPR now.
And if you can't stop the bleed, tourniquet.
Yep.
Yeah, they didn't incorporate it in our class for CPR, but
Did or didn't?
didn't.
Hmm. An excellent class as part of the CPR. So we have different kinds of injuries. We have bleeding. We have neck and spine injuries, chest trauma, cardiac trauma, and multiple trauma. All I need you to know is what kinds of emergencies or traumas may happen. Okay, so if you can just know what kind of emergencies you need to be prepared for, and then review this right here. The evaluation, ABCDE, on page 1053. You'll have a good understanding of what needs to be covered with patients' emergencies, shock, trauma, okay? The next part I wanted to cover was, I'm in the wrong chapter here, chapter 3, which was legal and ethical aspects of nursing. Okay, you were only asked to read pages 35 and 41. So let's go see what's there. I can tell you what's there, but let's go see. Okay. So here's what we need to know. Box 3.2, I believe this is. What does the patient what are our patients expecting, our clients expecting, not only in the hospital, but in the community? Okay. Well, this is more geared towards what do they expect for their hospital stay. And these are things that you should be aware of in your job. These are things that you should have ongoing education about. But it is important to know, let's say you were a patient in the hospital or your family member was a patient in the hospital. Wouldn't these be things that you would expect? High quality care, clean and safe environment, that the nurse is involved in your care. They protect your privacy. They communicate with other healthcare members, right? So it's important. I would like for you to review this box 3.2. Okay. The other part of what I want you to review is HIPAA. What's HIPAA? Patient rights, right? Privacy. Portability. Okay, so I would like for you to be aware of the 6 patient rights and provider responsibilities with regards to HIPAA. Okay, and I just would like you to know what the names of those are: consent, notice, access, amendment, accounting for disclosure, and restriction of disclosure. This is a combination of rights that the patient has and the rights that whoever is sharing the information, whether it be a doctor or a hospital or anywhere, those come with kind of rules and regulations to protect patient privacy and let them travel around, right? You can't go into any healthcare office at this point without signing HIPAA paperwork, right? That HIPAA paperwork is giving that place you're at permission to share information. And you are giving that, wherever you are, permission to share information. So it comes with responsibilities of both you, the patient, and the healthcare provider or institution you're in. Okay. And then the third thing I wanted to go over was negligence and malpractice. Okay, negligence, failing to meet the standard of care. So we all operate within a scope of practice, right? There are standards of care that we are expected to perform. Okay, so negligence is failing to meet that standard of care, failing to do something that is prudent, responsible, prudent, that any of us would do. So for example, if there's 10 of us and we're all asked to do the same task, what would a reasonable person do? 9 of us may do whatever the task is the correct way, and 1 of us may not. Okay, so that one person would be failing to meet the standard of care that's set. Okay, malpractice is essentially negligence by a professional person. Okay, the person doesn't act according to professional standards as a reasonable, prudent person would in the same situation. That's why there's so many requirements for licensure, performance. I mean, think about when you apply for a license. So maybe an example of malpractice would be if a nurse did not check the patient's vital signs after surgery. There was a hemorrhage and the patient died, went to shock and died. So in order to prove malpractice, I'm right here, 4 elements must be present. And here are your 4 elements right here in box 3.6. So please take a look at those. Number 1, we have a duty. We have the obligation to provide due care. Nurse has the duty to monitor the condition of a patient whom they are caring for. That's our duty. Okay, the second is there's been a breach of duty. There's been some kind of failure to provide due care. Nurse fails to check the vital signs or condition of a patient after surgery, we just talked about. Or maybe your client has a DNR and something happened and we started CPR. That's a breach of duty, right? Causation is the third element, where our action or lack of action caused injury or harm to the patient. There has to be a direct link between your breach of duty and the injury. For example, nurse's failure to check the patient's condition led to an undetected blood loss and caused the patient's death. So your failure to check the patient's condition contributed to the death. Okay? And then the fourth element is injury or damages. That there actually is harm or some kind of disorder that results from the negligence. And a lot of people don't think about this, but we just think about physical injuries. But injuries may be physical, emotional, or financial. Pain and suffering, loss of ability to continue your job, physical or emotional disability, right? Extending your hospital stay or death. All those would be considered some kind of injury or damage from a negligent action. Okay? It's not a happy subject to talk about in healthcare, but it's an important one. That's why we have standards of care, ethical ethical standards, scope of care, standards of care, and all the different kinds of nursing we would be working in. So I highly encourage you to be familiar with all that. And NCLEX will test you on all of this. Okay? It's a real concern. Okay? And that's where the NCLEX thinking of applying knowledge to clinical comes in. It's fine that you have the knowledge, but can you take that knowledge and practice within the standard of care? That's where a lot of mistakes happen. Right? Okay. All right. That's all I want to cover there. Any questions on that?
That was all of
What-
chapter 3, or
That was the pages you had to be though it's not all of chapter 3. You were responsible for pages
Well,
35.
35 to 41 is what I meant.
Yeah.
Okay.
Those were the few things there were 3 different things I wanted you to pull out of that. Negligence, malpractice, HIPAA. What was the third one that we covered?
The safety, the home safety and the,
No, that was in the med surge book. I'm in
oh, that was
fundamentals
med
now.
surg. You're in
Let
fundamentals.
me go back. 35.
HIPAA, negligence,
Partnership.
malpractice.
Patient
Partnership.
partnership. What are the expectations of the patient? What do they have of us? Okay. Okay, let's go to chapter, what are we at? 14. I'm actually going to use part of the study guide for this. Cultural and spiritual aspects. We're in our last week of content. This is it. What have we learned about cultural differences, cultural competency, spiritual aspects of patient care? Let's just review. What have we learned?
That it's not about me
Mhm.
and how I
All
feel.
cultures, sorry,
No?
all
Go ahead.
cultures are different.
Mhm.
Not everybody in the same culture group will follow the same thing. So everybody's individual.
What else? Do we try and incorporate our clients' cultures to the best we can, their beliefs, their values, their practices? We try and
Yes.
incorporate that into their health plan, right?
Yes.
If
What
we
they
can.
eat, what they eat, what they
What-
can't eat.
Mhm. Visitors, who can be in, who cannot. And on the last page of your study guide, it talks about, and I'll just repeat it, cultural considerations, religious, this is cultural and spiritual. So cultural considerations, religious considerations. Okay, I'm going right from your study guide. There are certain aspects of cultures that influence life decisions, life choices. And based on your study guide, we talk about food. For example, you talk about the Jewish and Muslim cultures. There's only certain kind of meats they can eat, right? Certain kind of butchered meats. Muslim culture, no pork. Jewish culture eats kosher meat. This is right from your study guide. Other influences, they have different values, beliefs, practices about smoking, about drug use, herbal medicines, nutrition, caffeine, alcohol, food preparation, and reading material. So this is the list I give you to review and study from for your exam, because you're going to get asked about what influences life choices in different cultures. And that's the list. Food, smoking, drug use, and so on. That's in the last page of your study guide. So to the extent that we can, try and incorporate, knowing that those categories certainly influence the cultures, we have to be able to try and incorporate that into the plan of care, right? To the best that we can. What if you are not knowledgeable about a certain culture? What do you do?
If you don't know about the culture,
Let's just
read up on
say,
it, look it up, find out.
what about asking the client?
Oh, yeah, that too. Well, that's what I mean. That's
Yeah.
part of the,
Yeah. I mean, we can't expect to be knowledgeable about every value, belief, practice from every culture, right? We have to ask. That's the process of becoming culturally competent. Right? Being able to first check our own feelings and personal beliefs. Right? And once we've checked that box and we're comfortable taking care of whatever culture we're taking care of, then learning about their culture, find out what's important to them with regards to healthcare. And then the three cultures for purposes of this chapter that I want you to know about, and I think there is a box in here that it is Christianity, Islam, and Judaism. Okay. Major religions in the United States and Canada. Okay. So I just simply want you to know that we focus on three in this chapter. Okay. You could read the beginning part, each section of each of the religions. It gives a nice summary. Okay. So you're asked to read 187 through 200. So that's what we're going through now. All right. And I'm just trying to minimize how much reading. Okay. So we're going through those three religions. Okay. But I just need you to know that what the three religions are. And then developing cultural competence. We've been kind of talking about this all term, right? Cultural competence involves knowing yourself and examining your own values, attitudes, beliefs, and prejudices. Trying to keep an open mind and trying to see the world from a different perspective. Right? And then I just wanted to review a couple of barriers, some barriers to cultural competence. What's going to get in our way of being culturally competent and able to take care of clients of different cultures? Well, stereotyping, prejudice. Here's a list of them here on page 194. Okay, stereotyping, prejudice, ethnocentrism, and then cultural imposition, cultural contact, cultural shock. So I'd like for you to be aware of what some barriers are. And we talked about cultural differences a little bit ago. This is in your study guide, but particular areas in which cultural differences are evident: time, personal space, family and social organizations, nutritional practices, death and dying. Okay. Some cultures are past oriented. Some cultures are present oriented. Some cultures are future oriented. Some cultures like to hug. Others find that very threatening. Nutritional practices. Some cultures feel very differently about death and dying. Okay. And if you would like to read, this is an interesting box. It's not highlighted, meaning you don't need to know it, but it'd be interesting to read it. Table 14.3. It goes through common cultural values, beliefs, and practices with common populations: Asian Americans, Hispanic, African Americans, Indians, Europeans, and Arab Americans. Look at the differences. If you want a little cheat sheet, there's your cheat sheet.
All right, I have a question. What edition book are you going by? Because my pages are different from yours.
I'm going whatever is in the, I think it's the, I have to go back and look. It's in your module. Hang on.
Okay, no problem.
Let's go into the module and see what the books are.
Because I think I have an older edition, because you're saying
Oh.
we're at certain boxes, and I'm like,
Okay.
okay,
We're in our fundamentals book, so we're in the 6th edition.
oh, okay, so I'm one, okay.
Well, it's
I
right
found-
here. It's right in your, I'm in your syllabus.
All right. Well, I got an older version of that book. So they
Oh.
must have updated it since I got mine.
Hmm. Okay.
Because I've had my book from a previous class, so, and I took that class a long time ago, so
Oh.
it's been upgraded. So I'm like, wait a minute.
Well,
that's
there's a
wait,
conversion guide.
Okay,
Where's the conversion guide?
okay.
There is a
I-
conversion guide. So where is it? There's a conversion guide. I'll find you the conversion guide and send it to you.
All right, thank you.
Okay. And it's just off by pages. It's the same content.
Yeah,
It's just off by
It's
pages.
off.
Okay.
Not by much, because I found some of the boxes already.
Okay. Awesome.
I just didn't find the one particular one that you were talking about.
Okay.
I'll find it.
All right. I think, oh, this is the other section that's excellent for you to read through. This is nursing process and clinical judgment with regards to transcultural nursing. This is an excellent read about going through the ADPI, how to apply your clinical, how to apply the nursing process and clinical judgment. Okay, for nursing with different cultures. It goes through all parts of the ADPI. So I would highly suggest as a review that you review this section. This is going to be pages, the last couple of pages that we need to know, 198 through 200. Okay. Excellent, excellent section. Excellent review of nursing process. Okay. So that is what's in our book. I want to review, to make sure I've covered it all, I want to review a couple of things on your week 9 notes. And I realized I've gotten 3 or 4 emails that you can't open the week 9 notes. Is that right?
Yeah,
I'm
I couldn't
correct.
open it either.
I'm going to send, when I send you out the recording for today, I'll attach a clean copy of the week 9 notes. Okay. So it's on my to-do list. I just didn't have time to do it before class. So on your notes, we talk about culture. We've talked about that. Ethnic groups, maybe cultural similarities, differences. Culture encompasses a wide range of behaviors, language, touch. Actually, let me share my screen because I think I have those up. Oh, that's your study guide. I thought I had them up, but I don't. So I'm just going through. So culture encompasses a wide range of behaviors such as language, touch, personal space, body language, perceptions of health. So again, just an extended list of how cultures are different. It also influences family structure, right? Childbearing practices. We talked about time orientation and eye contact. There are some cultures that you don't make eye contact, right? They don't make eye contact. We can't take that as hurt feelings or they don't care, that's their culture, which is why we're always working. After 40 years of nursing, I'm still working to be culturally competent. It's an ongoing process over the course of your profession. Okay. Nurses must approach each patient as completely unique and learn the patient's culture through observation and assessment. Right? We talked about that. And if you need more information, you talk to the patient, you ask the patient, you talk to the family members. You look it up, you do your own research. Let's see. Maintain an open and objective attitude towards individuals and their cultures. See them as individuals. We talked about to develop cultural competency, be sensitive to cultural implications during each encounter. Avoid stereotyping. Ask questions to stimulate learning about the client's culture. Avoid making assumptions. Okay. Okay. We covered everything in your week 9 notes about culture. The last thing I want to cover as far as content is violence. Okay. This is on your study guide. Okay, violence and abuse. We talk about intimate partner homicide. What is and you guys should have read about this. What is what's the top risk factor in intimate partner homicide? What do you think? Previous domestic violence. Remember that. Okay, that's on your study guide. Previous domestic violence is the top risk factor for intimate partner homicide. We know that violence is most common in vulnerable populations, just like substance abuse, as a means of exhibiting control. Okay, there's victims and there's perpetrators. We know that high levels of violence are tied to health disparities and adverse health outcomes. Maybe chronic stress, physiological conditions, mental health conditions, obesity, diabetes, hypertension. Right? We know that nurses, we are mandatory reporters, right? For violence against anybody, not just children. We are all aware of that, right? Is that just in your work setting? Could that be at the grocery store? If you observe something, could that be at a family picnic? A carnival?
Could be anywhere.
Anywhere. Anywhere. We are mandated reporters. Okay? We know that kids who are exposed to violence are victims or witnesses are at higher risk for mental disorders, self-harm, and substance abuse, and suicide. Anybody surprised about that?
Quick question about the reporting. So we see something, we're shopping outside and we see abuse. Do we just step in and report it, or
Yeah.
I don't understand that part.
You step in and
No.
you report it. You don't, at least you report it. You don't go up and say, hey, what's going on? Or hey, I'm going to report you. Or you just, if you witness abuse, you have to collect as many details as possible and report it. Right? You don't want to get involved. Your role is simply to report it. And it could be reporting it to maybe the manager of the store. But if you see it, you're the one who's supposed to report it.
Mm.
And that's anywhere. You know, being a healthcare professional puts us at we have more responsibility and more obligation to report, right? Where a friend may not want to report their neighbor. Well, they're not mandatory reporters. We are. Does that make sense?
Yes, thank you.
Okay. What do you think some leading risk factors are for violence and abuse? We talked about suicide, depression, or excuse me, leading risk factors for suicide. This is in your study guide. What are some leading risk factors for suicide? Depression is a big one.
Drug
Mental
use.
health. What?
Starting to use drugs
Yep.
can lead.
Yep. Substance abuse, mental disorders, depression. Those are the three leading risk factors for suicide: depression, other mental disorders, substance abuse. Some other risk factors, maybe a prior suicide attempt, family history of suicide, mental disorder, substance abuse or violence we talked about, violence in the home, firearms in the home, incarceration, maybe being exposed to suicidal behaviors of others in the family or peers. And then children who threaten to harm others or who abuse animals are much more likely to hurt others versus themselves. Does that make sense? People who become involved in violence are typically have had a previous exposure to some form of violence, right? Abusers were often beaten when they were children, or they witnessed siblings or one of their parents being beaten. They learn that violence is the way to manage conflict.
It's a vicious cycle.
The vicious cycle. Yep. And then parents, parents are at risk. Okay, parents with low social support. If they have a tendency towards depression, multiple stress factors, let's say they lost their job, they don't have the peer support anymore. If they have a history of abuse, they are at risk for abusing their own kids, right? It's a sad topic to have to cover, but very, very prevalent. And then we need to know the difference between neglect and abuse. Can anybody share the difference between neglect and abuse? What's neglect?
Not doing anything.
Failure
care
to
for- Yeah, failure to care, provide.
Failure to provide adequate food, clothing, shelter, hygiene, necessary medical care, emotional neglect, basic nurturing. How does that compare to abuse? What is abuse?
Abuse is actual physical action
Yep.
of harm.
Yep, please know that. That's on your study guide. You're going to need to know that for the exam, the difference between neglect and abuse. So if you're given a scenario, is this a scenario of neglect or abuse?
Hands on, hands off.
That's it. Danny, hands on, hands off. It's about as clear as you get. Okay. So that covers and again, the information I just shared with you is on your week 9 notes as well as your study guide. Okay. So any questions? So that's it for content. We're done with content. Danny's clapping. let's just take a couple of minutes to go through each of the presentations. All I'm looking for is quick summary of your presentation. My Monday class had lots of questions for the groups. It was great. But you worked so hard on them. You did such a phenomenal job. I just wanted you to present what you guys did. So I'm just going to start from the Alpha group. Gail, Peaches, Keandra, I don't think is here. Alfreda, I don't think is here. You guys, Gail's here, right? Where's Gail? There you are.
I'm here. I'm just pulling it up.
Yep, and Peaches is here. I know she's
She's here.
here.
She just went to the bathroom.
What?
I said she's here. She just went to the bathroom.
Oh, okay. Gail, why don't you give us a heads up on hepatitis? Boy, we are missing a lot of people today. All right, Gail, we'll skip down. Jessica, I know Jessica's here. Chris is here. Oh, is Naomi here?
I have it. I'm sorry. It was taking,
Oh.
it took a minute to load.
No, I was
You
just
still
going
want
to
me
give you
go?
some time to pull it up. So just give us a summary of hepatitis. What was your project? And then Peaches
I
can
have
jump
on
in. Which,
here. It's the inflammation condition of the liver tissue.
Mhm.
There's different strains of hepatitis, most commonly hepatitis A, B, and C. Depending on which ones, you can get acute flare-ups that eventually go away, or if it's chronic, it can be long-term, and it can accompany with progressive liver damage. 5 different viruses that can cause different forms of hepatitis, such as hepatitis A, spread from close or sexual contact and intravenous drug use, and is more commonly known for its spread of transmission through contaminated water and food.
Okay.
I'm just trying to summarize it. I'm sorry.
Yeah. No,
Hepatitis B is transferred through tainted blood, used syringes, bodily fluids, and it
Mhm.
could be also from mother to newborn.
How's it treated?
Hold on one second. I gotta scroll down.
Is it can you treat it? Anybody can jump in. Can you treat hepatitis? Anybody?
I want to say yes.
No. Wouldn't it be a virus that would always be in liver tissues, like all
It just goes dormant.
Exactly.
Hmm.
It's a virus. Can you treat a virus? Well, you can do antivirals, right, Gail?
Yes, I know.
To help minimize the symptoms, but as far as long-term, right? Symptom management, a lifetime of symptom management. A lot of times it's latent, right?
Mhm.
Is that right, Gail?
I'm sorry.
No,
my
you're having to
computer's acting
kind of
funny.
cover everything here, so I
Um,
appreciate it.
I have depending on the type, antiviral medication combined with the use, maybe used to treat the virus. Medications that are used to treat disease is, oh my gosh, I don't even want to attempt to
Are they
name.
antivirals?
Yeah,
Yeah, we just know that you can treat it with antivirals.
Yes.
Right? It's not curable.
so yeah, different interventions for
Mhm.
each individual depending.
Mhm. Is it reportable, you guys? I'm asking out. I'm trying to help Gail out here. Is hepatitis reportable
Yes,
to the health department? Why?
because it can spread. But isn't
Clinical.
one oh, well, I don't want to interrupt. All right, go ahead.
No, go ahead.
No, that's fine. I can research that on my own.
Okay. Does anybody have any
Doesn't
que-
A and E have a vaccine? Was it? Which one is? Wait a minute, which one are we talking about?
hepatitis?
Yeah. Isn't A and E have a vaccine?
Mhm.
B, C, and D don't.
Mhm. A has a vaccine. When do we get those vaccines?
That part I don't remember.
Babies,
Oh, yes.
HEP, the
That's
HEP
right, babies.
vaccine, right? Right, Gail? It's two. It's a
I think
two-dose
Hep B is, isn't that when you're a newborn?
Hep B.
Yes.
Mhm. Hep B is what there's a vaccination for. Right? Anybody else have any questions for Gail? She kind of shouldered the group there. Yeah, Gail. Anybody have any questions for Gail about hepatitis? All right, let's go to Bravo Group that did HIV. Jessica, I don't see Chris here. I don't see Naomi here. Renaya, you're here, right? You and Jessica.
Naomi's
I'm
there.
here. I'm also
Oh, where's
here.
Naomi? Where are you?
Chris is there also.
Oh, there you are. Where's Chris? I don't see Chris. I don't have Chris in here, but I see Naomi, Jessica, and Renaya. Go ahead. Anybody can talk about any part of it. Any of you three?
So HIV, it attacks the immune system. If it's left untreated, it can turn into AIDS. There's no cure. It can be controlled with medication.
Hmm?
Uh,
What kind of medication? Is HIV viral or bacterial?
viral. So
Antivirals. Right?
yes.
Right?
It's a reportable disease to the CDC
Definitely.
because it's a disease that can really impact the American population. It can like she said, if it turns into AIDS, then it does become fatal. People are living a lot longer with it now. There are more antiviral medications to treat HIV as of right now.
Mhm.
But one of the most vulnerable populations to HIV is the homeless and the LGBTQ community. Homeless would be number one because they're homeless and they're outside and they're exposed to more. Also, drug addicted people, for the most obvious reason, they're on drugs and they use like dirty things like dirty needles, and they're getting high or whatever the case may be in unsafe and unclean areas. Um,
Let me ask a question.
okay.
You just talked about homeless, but you also said that one of the other high-risk populations are LGBTQ.
Mm-hmm.
So why would they be at risk? I have an answer. I'm just
The type of sex they have.
keep going, Danny. What's going?
HIV is found in the rectal fluids.
I was gonna
And
say
most
anal.
and most HIV, most men that contract HIV are having sex rectally,
A lot
anally,
of the
should I say?
a lot of the LGBTQ community are usually homeless.
Mhm. You guys are so smart. So I'm thinking more of the homosexual male that may have rectal tears. Right, Danny? Rectal,
Absolutely. You're twice
rect-
as likely to bleed through anal sex for obvious reasons than you are through vaginal.
So as we think of homeless population as well, like Makeda said, a lot of LGBTQ are homeless, right? However, if they're not, just because they're not homeless doesn't mean that they are not at extremely high risk for HIV, right? Okay. Can I ask another question about HIV? you have a client, you're working in, you have a client that comes to you and says, I recently had unprotected sex over the weekend. I already did my HIV test. It's negative. I'm in the clear, right?
No, they gotta go back in 3 months
Why?
because it's not, it's good, it could be a false negative right now because it's too early to tell. So they have to wait.
So your education to them would be way too early to tell. You'll have to come back in 3 months to get retested. There are a lot of false negatives, false positives in the first couple of months. Is that right? Is that the education point we want to go with?
Well, until then, to practice safe sex or state abstinence, practice abstinence.
Okay. I'm just adding my notes from the study guide. Jessica, Renaya, Naomi, what else do we want to add about HIV? I didn't mean to jump in, but it was a good time to include that information. What else?
There is actually a prep you can take to prevent your chances of getting HIV. It's used after possible exposure and can be taken within 72 hours. It's a pre-exposure prophylactic. It's
I don't think I knew that.
My thing is, are you actually going to find out within 72 hours if you were exposed to actually be able to take that?
well, no, that I would
think it's
assume that would
more-
be like if you had shared a needle or had a sexual contact with somebody and they came back and said, oh, hey, by the way, for whatever reason, I didn't tell you yesterday or before we had contact, then that person would be able to go get the prep and it would possibly limit their chances of actually contracting HIV.
Yep. Excellent. Yolanda, does
And
that
the
make sense?
medications that are out today, they can actually make HIV undetectable. If you stay on the right regimen, you can actually become undetectable after taking the medication.
Great information. Anybody have
That's
any questions?
interesting.
Yeah, very interesting. Anybody get Naomi or Renaya? Do you guys want to add anything?
No, I was just gonna say about the PrEP medication and also the post exposure prophylaxis. They have one too.
Okay. See, every time I do this every term with the students and I learn something new every time these topics are presented. Fascinating. Awesome job, guys. Great. Charlie Grew, whooping cough, aka pertussis. Makeda, Danny. I know Amani's here. I've seen her. Did Alyssa make it in here? Alyssa said she was going to be late, but I guess she didn't make it. So Makeda, Danny, and Amani, tell us about pertussis.
Okay. So pertussis is also known as whooping cough. It is called from a bacteria called Bordetella pertussis, and it's an exceedingly contagious illness. The symptoms of pertussis typically start off as flu-like symptoms, leading to uncontrollable coughing spells. And it also develops into a series of fits that can last for several weeks. The way that we try to control it is, according to the CDC, the best way to prevent whooping cough is to get vaccinated. There are 2 vaccines that you can get. Those vaccines are the DTaP and the Tdap vaccine. The DTaP is administered to young children, whereas the Tdap vaccine is administered to preteens, pregnant women, and adults. And it can also provide protection against tetanus. However, these vaccines cannot give you whooping cough, tetanus, or diphtheria. And you can also use preventative antibiotics to help control the exposure of whooping cough.
Excellent. I'm really familiar with whooping cough after being in the schools for 20 years, but keep going. Danny, you want to add anything?
So my bit was on the National Notifiable Diseases Surveillance System, or the NNDSS. It's basically a collaborative effort across organizations and government agencies to monitor and surveil disease progression, disease spread, whether there are new strains, and whooping cough or pertussis is indeed a nationally notifiable disease. And it's a chain of command. So, your doctor finds out, you get a confirmed positive test. The health department is notified, who then notifies the CDC, who then notifies the NNDSS, and then a collaborative effort of tracking and monitoring the disease to control and prevent the occurrence and spread from state to state is reported regularly, as well as other nationally notifiable infections and non-infectious diseases and conditions.
Excellent. Yep. Where is Makeda? She was just here.
I'm right here.
There you are.
My part was
Your
on
picture
the-
keeps moving around. I don't know why. You're at the bottom. You're in
I
the
had
bottom
to
row
leave
now.
out. It was acting up, so I left out a few times and came back. My part was on the prevention as well as also how to treat it. First line of prevention is vaccination. As Amani mentioned, it's DTaP and Tdap. DTaP is for diphtheria, tetanus, and also pertussis, and it's for the younger children. It's for children under the age of 1, so between 2, 4, and 6 months. Is scheduled between those times. The 4th dose is usually about 15 to 18 months. My daughter, she's due for one within the next few months, so she'll be getting her 4th dose of DTaP. 5th dose shouldn't occur. It should occur between the ages of 4 and 6. Tdap is usually recommended between the ages of 7 and 18, also for older people as well. For those who are not vaccinated, it's treated with antibiotics, Thamycin. So as I'm not even going to try to pronounce it, but usually we know what the Thamycins are. And also trimethoxam sulfamethoxam is also one as well. So the usually is given between the first 2 weeks of infection before coughing, and the paroxysm begins, which is like the heavy coughing and the wheezing, which is associated with pertussis. If it's not treated immediately, long term, like if you continue on coughing and you're not treating it well, you will develop like a really, really bad infection. Prolonging it can cause really bad complications, especially with infants. That's all I have for my
And
bit.
the elderly.
Yes, especially the
Very
elderly.
high risk for pneumonia. Right?
Respiratory
So,
infections that can bring on RSV as well.
exactly.
Yeah.
Great job, guys. I have some questions. So, what happens if you're working in an environment with kids, say the schools, and families are not immunized? They've chose through their own will. They've done a religious exemption, a medical exemption, a personal exemption, and they have chosen not to get vaccinated. What's our role? Against pertussis. I'm just going to use pertussis, and they've chosen to not get vaccinated against pertussis. What's our role as nurses?
We can treat them with antibiotics, as
Educate
Makeda
them.
mentioned, azithromycin,
Educate.
erythromycin, but it has to be done during the first 2 weeks of infection before the coughing starts. But if it's given later, the duration of the illness, the treatment is not effective.
I heard
They
somebody
can
say
also-
education. Who said education?
I did, and somebody else did.
Okay, tell me.
Educate the families. What could happen if they do not get the immunization? What is the outcome? What could happen if they do not? You have to give them what can happen if they don't and what would happen if
Mhm.
they do.
But we don't want to scare them, right?
No, it's just so they
Okay.
can know, both sides, so they can make a decision after
Right.
getting all the information
Perfect.
of, if you don't get it,
Perfect.
this is what might happen. If you get it, this is what might not happen, or it could be a less of effect, not as bad.
Okay, so Yolanda's providing a lot of detail to families. What I would do is if families are not vaccinated, I would simply tell them, try and educate them that vaccines are the most important treatment for vaccine preventable diseases, right? And in the schools, I would come up with a backup plan. So if pertussis broke out in the schools, a school, I would first go to my immunization list and see who was not vaccinated against it. Okay, no judgment, just find out who's not vaccinated. And then I would call the parents and say, hey, we have an outbreak of pertussis. My recommendation, can't force it, my recommendation would be that you keep your kids home from school until this has worked itself through. Right? That's what I would do. Yolanda's taking it one step further, and she's going to go through, if you get it and you're not vaccinated, here's what might happen. I don't know that I would go that far because I wouldn't want to scare the parent. However, if they did want to have that conversation, the only reason, Yolanda, why I'm saying that is I wouldn't want to try and make the parents feel guilty about not being vaccinated.
Well, it's not trying to make them feel
Okay.
guilty. I mean, the only reason why I said this is because this is what we were told. Always give the information
Yeah.
of.
Okay. That's fair.
So that's the only reason why I went there. I mean, I would have
Yep.
checked the medical records also to see who's not vaccinated
Yep.
because I remember reading that.
Yep.
But I thought you meant like other than that.
Well, the other avenue you can go with unvaccinated kids is, hey, I'm calling to inform you I've had an outbreak of something at the daycare, pertussis at the daycare, the school. Please contact your own physician and get some guidance. Right?
I do like that.
Yeah. That's what we did in the schools all the time. Call your doc. Okay, well, that was my that was my question about unvaccinated. Educate, educate, educated, but can't make them feel guilty, can't be judgmental. It's their choice. There are religions that don't believe in vaccinations. There are medical conditions that you can't get vaccinated. And then there's personal. I'm just not going to get my kid vaccinated. That's a personal exemption. Okay, good, good. Great job, guys. All right, last group. Ebola. See, Dwayne, you still here? Yep, you're here.
The
Karen's
whole group is here.
Oh, good. Okay.
Yeah.
Go.
I had the first section, so
Okay.
it's of what is Ebola and where did it originate.
Okay.
Ebola is also known as hemorrhagic fever. It is a virus, a rare virus, and it affects humans and non-human animals like primates, chimpanzees, gorillas, I couldn't pronounce this one even when I wrote it. It's in the family of antelope and pigs. It can be it's transmit. Let's see, what was it? Also, and fruit bats, which can carry it and spread it even more. Ebola was identified in Zaire, Africa, in a small village, which is in the sub-Sahara of. Oh no, wait, I'm in the wrong spot. Sorry. In the village known. In Zaire, Africa, which is now known as the Democratic Republic of the Congo, near Ebola River, which hence that's where they got the name.
Yep.
Because of the river, because they noticed the different, after that particular outbreak in that section, they noticed anybody that was living near a river at the very beginning, because the rivers were connecting. the first doctor who act in 1976 was Dr. Jean, I do not know how to pronounce the name, Jacques, obtained blood from a nun who was infected before she passed. And he took those samples and sent it to a Dr. Peter Piot, who received the majority of the credit because he also is the one that discovered Ebola. That was my section.
Awesome.
I mean, I have more, but
Great.
it's just, that's the skinny of it.
Okay, next.
Okay, so I have section 2, which was ways we attempt to control transmission. So when we know the outbreak happened, obviously we're trying to confine PPE, they mask and N95s, not just your regular surgical. When we don't know, PPE is always number one way to prevent getting any type of viruses. It is transmitted through fluids, bloody fluids. They say it's also transmitted through sweat. Not as much as a cold, which if you sneeze or whatnot, I don't really believe that. I'm a germaphobe, so I wouldn't want to inhale whatever, sneeze, anybody coughs. But yeah, transmission is just PPE, obviously treating soiled linen, soiled anything from the patient affected with Ebola with care and cautious, and to put it in red bins so no one can touch it or get affected with it. They do have antibiotics to treat it when someone is affected with it. Death rate is high. I don't think that's much my section, but anywho, death rate is high if not caught early and in time. It starts off with flu symptoms and then progresses. And I believe they do have a vaccine.
Is there Ebola vaccine?
I didn't read much into it.
Oh, I didn't.
But they produced one, yeah.
I didn't know
And
that.
that's Dwayne's section.
Okay.
Okay, and cut. And that was mine.
Awesome. Thank you. Dwayne, you're up.
Oh, no.
Okay. So basically the treatment for Ebola is and antiviral methods. The main medication for treatment of Ebola is called Ibenga. So Ibenga is basically a monoclonal antibody, which basically acts with the natural antibodies. So it basically prevents the virus from replicating in a person that's infected with Ebola. The route the medication is given would be through IV infusion. It usually take about an hour. The side effects of it is vomiting, hypotension, chills, tachycardia, and diarrhea. This treatment is good for pediatrics and also adults. And also, it's best to be treated as soon as possible, because if you're not treated, it's a big chance you're not going to make it.
Great. Karen.
Okay.
Thanks, Dwayne.
Ebola has no cure, and the researchers are still working on it since it's caused by a virus. And there are fewer targets for the treatment, but there are 2 drugs that are used to treat it, that have been approved for Ebola. And then my part was about the surveillance. So the type of the surveillance that the State Department uses to track Ebola are the case-based surveillance system by sustaining the case surveillance and contact tracing and interpreting surveillance data. I also found that Ebola can also be tracked and surveilled by a team of medics, whereby like every morning they check on the several health centers and communities in search of possible Ebola cases. And then in search of an alert when suspected, the cases are reported by the health facilities, communities leaders, or the families that refer to the specialized testing facilities. That's what I got.
Great. So help me understand. Karen, did you say that there's a vaccine in the works being developed, or there's already a vaccine developed?
So
No, I didn't say there's a vaccine developed. I just said there's no cure for it.
There's no cure. Okay.
Yeah. Mhm.
Because I hadn't heard about an Ebola vaccine. Okay. Gosh, great. Great. Good job, you guys. Does anybody have any questions for the group? Actually, this is a good time to cover infectious diseases like this because when you look when you look at your study guide, you're going to see hepatitis, you're going to see HIV. So anyway, great job, everybody. I learned something. I learned a lot of things again. Did everybody learn some new things that they didn't know?
yes.
Yeah.
One of the ways that the Ebola is transmitted is through semen.
Oh wow, I didn't know. It's so
Yeah.
so that would count as it being sexually transmitted then?
Yeah, it's through person to person, broken skin, mucous membranes, eyes, nose, mouth, fluids, breast milk. It's also transmitted through breast milk.
Do you remember the scare we had?
Mm-hmm.
I think it was
Also,
back
I
in,
think what Yessie was referring to was Ervebo. And Ervebo is actually a vaccine for Ebola.
oh,
It was just recently approved by the FDA.
Is it a prevention? A preventive?
It is a preventative vaccine,
Okay.
wow.
but you have to
Well-
be 18 years or older to get it.
I was just gonna say at what age?
Yeah.
Okay.
I have a
Alright.
question about the hemorrhagic portion of it. So when it's hemorrhagic, the internal or external? It's
Excuse me?
It's called it's a hemorrhagic fever. So with it being hemorrhagic, is the bleeding external or internal?
I believe
It
it's
comes from your
internal.
eyes, your
No,
ears,
it's all tears, ears, nose, mouth.
every orifice.
Yeah, wherever it could come out of, it's gonna come out of.
Did you see that movie? Anybody see that movie Outbreak?
Yes,
Yeah, so-
Yep.
so
love
similar
that
to-
movie.
Isn't Outbreak about Ebola?
Yes,
It is.
yes, it is
Sure.
with Dustin
It was?
Hoffman.
Yes.
It was
and
about
it's-
Ebola.
It's
Yep.
about Ebola. Yep.
I haven't seen it since the 90s. So I think
Yeah, but it's all discharge from everywhere.
And it was from Patrick Dempsey. Brought a monkey illegally
Oh yeah.
in, and he got sick on the plane. And then he was sneezing and coughing, and it spread through the plane.
I remember now.
I'm gonna have to go back and watch that movie over the
I
weekend.
love that movie. I'll watch it again.
I haven't seen it in a while. So, well, great job, you guys. Really great job. I appreciate everybody's participation, engagement. Awesome. You all did a great job. So that's it for me, but I'm begging you to watch the reviews for the next exam. We're in the home stretch now. Get your HESI prep done and in, okay? If you haven't turned it in yet. And then you know where to reach me if you need anything. Okay? I'm going to take Friday off as a personal day. And so I'll have I get all my emails to my phone. I get all the Canvas emails to my phone. So even though I'm going to be off, if you reach out, I'll respond. Just maybe a little bit longer. I'm just going to take a day off and try and regroup here with my grandson.
You need
Okay.
to do that.
Perfectly understandable, and we're praying.
Yes.
Yeah.
Yes. Amen.
Thank you for
Yeah.
everything.
Thank you for all your
Thank you.
prayers. All right,
Absolutely.
bye, you guys. Great to see
Have a
you.
good day.
You too.
Today was the
Bye,
last class.
thank you.
Bye.
Bye-bye.
Bye.
Was today the
Bye.
last class?